Hello guys. Today's webinar would mainly cover the course content which we will be offering from Jan next year. So the course is named as Machine Learning in Health Informatics. We will be having two parts of the course. One is the theoretical understandings, followed by some hands-on training. So today the course content will be covering mainly the topics and the topics details, which we will cover in the coming 3 months in the course. So just to introduce me, I was trained as a clinical graduate, basically a clinician. Then I shifted my career towards the domain of bioinformatics and health informatics. So I upskilled myself into the domain of data and data analytics. And now what I do is I combine multiple data types to build predictive models, ML-based models for a specific clinical outcome. This covers use cases from the hospital-based organizations, from the drug discovery companies to the life insurance providers. So for today's webinar, I have kept it in 3 particular subsections. First, I will cover the overview of health informatics, which we will be teaching in this particular course. Then I will briefly walk through the types of health informatics data. And lastly, I will cover the case study structure, which we will be following in the course. So overview of health informatics. So the first slide is how informatics is transforming healthcare in this particular stage of AI and machine learning. So as you can see, there are mainly 3 broad categories of health informatics. The first is patient care. The next major thing is business process and management. The third one is drug discovery and companies for pharmaceuticals. So for the domain of patient care, health informatics can be used to solve problems where we can manage efficiently appointments, clinical visits, waiting duration to the clinic. We can have precise diagnostics for particular diseases. We can prevent diseases by detecting them at an earlier stage. One important thing is patient triage. So a hospital would be containing, suppose, 1,000 patients. We need to stratify them into high risk, moderate risk, or low risk. And this triage is very important for patient care. So this triage is also done based on informatics. And lastly, imaging and diagnostic, CT scan images, X-ray images, any biomarker discovery, all these things also fall under the purview of health informatics. For the business process and management, there is something called process automation. So in business, so generating business reports, generating interactive and flexible reports is something which is also a very useful use case. Claims administration, that involves mainly predicting the cost of or the burden of patient or the high risk patients from the past claims history, medical claims history. So that is very important for the industry of healthcare claims. Customer churn. So what is the footfall in your particular clinic? When does the footfalls increase? In which month of the year? What are the factors that increases? So these things also fall in the purview of business management. Then chatbot, and lastly, business insights. For the drug discovery companies or pharmaceuticals, the majority is drug discovery. So identifying drug targets. So identifying molecular targets, gene targets, planning, logistics planning, and lastly, improving clinical trials. So which clinical trial, how can we manage clinical trials more efficiently? So these things fall under the purview of drug discovery and pharmaceuticals. So these are the major three industries where informatics is actually transforming the healthcare gradually.